Welcome to the Franciska Show podcast on JewishCoffeehouse.com, the show where I give a voice to Jewish issues, topics, and people. I'm Franciska Frady, your host. This is a Jewish Coffeehouse podcast, so make sure to check out the other podcasts on the network. I will be traveling to Germany this week to attend the Charlemagne Prize Award ceremony in Aachen. My father, Rabbi Pinchas Goldschmidt, will be receiving the prize, and I'm hoping to have something to share with you next week about the experience. Thank you for your messages and letters and notes of support, as well as suggestions and kind feedback. I always appreciate it. And if you'd like to support the show, please rate and review it, share it with a friend. This is the best way you can help grow this podcast. And here we go. Enjoy the show. Welcome to the show, Dr. Elissa Hellman. It's great to have you on.
Thanks so much for having me.
Can you tell us a little bit about yourself professionally and religiously?
I am a OBGYN, obstetrician gynecologist. I've been doing this for, including residency, 17 years, so a long time. And I practiced in Milwaukee, Wisconsin for 13 years. And just recently made Aliyah, and I'm not fully practicing. Thank you. I'm not up and running just yet. Some of the licensing stuff still has to go through. But 2 years ago, I started a telemedicine practice that I can do really virtually from anywhere. And I see mostly consults for Jewish women who are kind of going through some confusing, difficult, frustrating gynecologic situations that often impact their ability to practice Taharas Hamishpacha and just cause some problems there. So I try to help them figure it out medically without an exam, just over telemedicine.
Okay. So I'm assuming Aliyah pushed you to go into telemedicine.
So it's something I definitely thought about when I was thinking about opening my telemedicine practice. So we knew it was going to happen at one point. And I'm like, hey, it would be nice to have something I could bring with me, not really knowing how quickly I would be able to start working like in person in Israel. And my Hebrew is not the best right now. It is improving daily. So religious background, I grew up modern Orthodox and went to Jewish schools my whole life, went to secular colleges, medical school. And over the years, probably I'd say grew in my observance. And I would just call me like regular frum at this point without like picking, definitive labels. But we live in Ramat Beit Shemesh. My kids go to Beis Yaakov Haredi schools for living the frum life dream, I guess you could say.
We have spoken about women's perspective and issues on living with Taharas Mishpacha. We spoke about from a mikveh nida perspective. We've had a psychiatrist on who specializes in postpartum. We've also had the infertility therapy side. So this is our first time talking to an OB, from OB, something listeners have been recommending and suggesting. So I'm excited to be having this conversation. What do we need to cover in today's episode?
So I think specifically when like all the stuff you listed are all like offshoots and specialties of the field of women's health. It's something that I think, there are all these little experiences that women have, right? Postpartum depression or infertility or like specific issues that are pretty frequent, but it's not, I'd say, the norm. And I think when we start bringing awareness to topics, we start really focusing on these smaller groups of people going through these experiences, but we forget that there is the norm. And there is like the common general women's life experience going through all of the lots of different phases of life from a medical perspective also. And that education and that just what is normal kind of gets lost in the let's talk about all the other stuff. And it's still, I think it's amazing that we're talking about all these other topics, but I do think that the regular and normal gets lost. So people don't even like fully know anymore. Well, what is normal? And is this, what's common? And is what I'm experiencing normal, or is this something that's not?
It's like therapists think that everyone is struggling.
Exactly.
And every couples therapist think every marriage is on the rocks. Okay.
Exactly.
So tell us, what is in the norm of normal? And maybe we'll start with the beginning, which is maybe puberty, but maybe before puberty.
Yeah. A really big part of, I think, the education for everyone to kind of realize, or for, women going through all these very common life experiences, is to start talking about it. And that really starts from when all this process is starting, which is puberty, which is generally like middle school time. And there's such a huge variation in women's and girls' bodies. And that's also like that age group is when people, or these girls, are starting to look and notice differences. There's unfortunately a big emphasis on this type of clothes you wear, the size of clothes you wear, what your body looks like in comparison to what your friend's body looks like, and kind of doing a lot of education on what is normal and that bodies are all different. So when it comes to the very beginning and middle school, I'm going to put a little plug in for, if you are involved and if you send your kids to a Jewish school from school, try to get this education into the classroom by bringing like a nurse or a doctor in to kind of go over all this stuff. But kind of talking about the way bodies change hormonally, breast development, periods, body odor, acne, all those things that are very normal, but people may be ashamed of or uncomfortable about or yet made fun of for. And I think if it becomes kind of a more of an open discussion at this age, it's less of like something to feel self-conscious about. That's my hope, at least, that happens.
Shouldn't this be done by a parent?
Ideally, yes. Definitely, that is the ideal. Unfortunately, that doesn't always happen. And there are plenty of families where this happens and the mothers do a wonderful job of it. And then girls grow up feeling like they are aware of their bodies and they understand what's happening. But that is often kind of colored by the experiences that maybe they had growing up as a girl and as a child, and what they were exposed to and how comfortable those conversations were in the home. And if you grow up like not really talking much about it, does that translate into you not talking much about it to your daughters, or handing them a book to be like, here, read this, like you're at the right age, like a pamphlet, and I think that the importance of kind of bringing it into schools to kind of, like make it more uniform, is that it really helps cover those families who may not have the words or may not feel so comfortable with the language that it takes to kind of talk with their daughters about what their bodies are doing. And there's definitely ways to make the conversation more comfortable depending on what age. So if you want to keep just at body changes, you don't want to talk about periods yet, okay, start a little younger, right? And then like slowly work it up to where it becomes a little bit more of a comprehensive discussion.
So I went to school in Moscow, and it was a state school. So we had somebody come in. I have no idea. Maybe it was anywhere between 5th and 9th grade. We had someone come in probably a few times and just give us a basic anatomy/puberty class. We were also taught about the male anatomy and puberty process. Do you think in the Fromm system, should boys be learning about what happens to girls, and should girls be learning what happens to boys?
So I think that's a great question. My answer is yes, at the appropriate age. And the appropriate age isn't always the same in every family. I think you have to know your child's maturity level.
Now you flipped to the family. What happened to the classroom?
So classroom-wise, I think that it depends. And now this sounds a little different than what I was saying before, but in this education, to get what you want kids to know growing up, you have to meet communities where they are. And if I came to you, a super ultra-Orthodox school, and I said, look at my slide presentation, look at these pictures, and look at what I think every single kid, boy or girl, has to know. They and I put up pictures of boy and girl anatomy and changes and all that. they'd kick me out in 2 seconds and not even want to hear what I have to say. Whereas if you come to a community that can, like, it's a little bit more palatable to say, okay, for this group, I want to teach this. And for this group, I want to teach this because that's what's applicable right now. And then slowly work it up. I think that's appropriate. In the ideal, it'd be great if everyone grew up knowing about both genders and the function that happens and going through puberty. I just don't think it's realistic. And I think that in these kind of educational experiences, we have to be really realistic and respectful of the communities that we're in.
Can you give me the most chomridik society, and how would you teach them what you feel is necessary for them to know? If you had to go into the most conservative school that gave you permission to come in.
Yeah. So girls wise, and right now we're talking middle school because the conversation is, I think, different as girls who generally in more like ultra-Orthodox communities probably get married a little earlier in general. I don't want to make huge generalizations. So I think the education does change as girls age.
Maybe very early. Even if they don't get married, they're in the parsha of getting married.
Exactly.
Earlier than the rest of the world.
Okay. Right. For a middle school, like beginning of puberty type of conversation, I think it's a big focus on things that are happening to your body externally: body odor, hygiene, acne, breast development, growth spurts, how your body's changing. You may need to now shop in the women's section rather than the girls section. Your hips, your bottom, your chest, things are changing, but you're noticing this. Like, this is obvious. You may smell after like running around at summer camp. That these are things that you notice, and these are really a part of puberty. I think we sometimes think of puberty as just like breasts and periods, and there's a lot more to that. So starting with those like more external thing, like obvious things, and then we can start talking about like the inner workings of what are your internal reproductive organs doing, and externally, what's under your underwear. What does that look like? What to do when something doesn't feel right? What's the purpose of your organs, right? So I think talking very almost like making it a little bit more scientific and like, hey, you have ovaries for this reason, and you have a uterus for this reason, and removing, I think, the sexualness of it at that age, but laying the groundwork for it, I think, is super important, so that when we do start having more of like what is sex, and like how are babies made and what happens during a pregnancy, that the groundwork has been laid. And you're like, yeah, I know about the uterus already. I know about the ovaries already. Like, yeah, I got that. Now I'm like understanding the function a little bit more.
Let's move on to the next stage in life.
So to me, that would be education. Like, I think this is where a lot of sex ed comes in. And look, I'm really talking from my perspective of going through and talking at a lot of Orthodox Jewish girls' schools. I haven't really spoken much in a co-ed setting and given that education, though it very likely be the same for both. It's important information for both genders to know. Now, as far as what I kind of add to the conversation, and let's say we're talking like 11th, 12th graders or so, or really throughout high school. But, remember, like 12th graders could be married in a year or two and then start having sex at that point. And it's possible that's even happening before. We don't know, right? But it does happen. And to educate about how does pregnancy happen, what to do when there's pain or discomfort in any gynecologic region or organ, what is important for getting yourself checked out, like a yearly exam, what the exam entails, what your doctor may do, what are ways to kind of make that exam that you may be super anxious about a little bit easier or more comfortable, how to talk to your doctor, be like, hey, this is my first time. Can you use a smaller instrument, right? Like, just kind of give scripts for what, like when you're sitting there.
Smaller instruments that are not being used? That's my question.
There are. And, just kind of make the process a little bit less scary, because I think there's this girls talk and a lot of kind of misinformation is given. I recently was talking to a school and someone would ask me a question, and then before I could even answer, all the other girls would blurt out the answer, which was like so wrong. And I'm like, okay, guys.
What was so wrong? That the answer they gave was wrong, or the fact
the
answering?
No, the answers they gave their friend was wrong. And like they were asking me the question, but girls, it was lively. Let's just say that, which was great. And I love that. But I'm seeing okay, so this is the information people are getting like on the street, and we have to find ways to like really prevent all this misinformation. And the only way to do that is by bringing in people who are experienced with this and can give over the actual information so that you aren't misled. I also think that many Orthodox girls' schools also give some type of either relationship or shalom bayit or some type of hashkafa class in around like the 11th, 12th grade years. And I think this is such a good, like it meshes so well with understanding like hashkafically what that means for a relationship, but then also physically, like what that means. I sit there and I go over in more detail also about the menstrual cycle, not just like, oh, you get your period once a month, which is something and I'm not sitting there talking about like the hormonal levels up and down and ovulation and all that with a 5th grader, but with the 11th or 12th grader, they can handle that. It's their body. They need to understand why they're getting their period, what ovulation is, where does that match up with mikvah, which they have learned about in like a kind of a cursory way. And it helps that meshing and melding in their heads of like, oh, this like makes sense based on what my body is doing. I understand now like fertility a little bit better, infertility a little bit better, and kind of giving teenage girls a better understanding of their body as they're going in. So they don't have to like learn all of this. It's so much to learn. They don't have to learn all of it like right when they get married or when they're maybe thinking, oh, there is a problem. Either I'm having pain with sex or I'm having difficulty getting pregnant or, if something is going on, they at least have the words for it.
A common rebuttal that people give to something like this is all this information goes over their heads anyway, because some of it is so relevant to them.
I completely disagree with that. I think that is...
Have you ever had anyone say that to you or no?
Not to my face. Let's say that. But I think we need to give girls a little bit more credit. I think, and teenagers in general, I think we need, that's a really like thoughtful time. I think we think of teenagers as like wild and crazy and bad judgment and they don't know and they have to like get into real life. And I think that we can give them a little bit more credit and start educating them on like real life topics that they're going to have to know about. And we oftentimes, like, as in all the parenting advice and books, they're like, like instead of just telling your kids something, show them like they're watching you, they're listening, even though it doesn't seem like they're listening, like they're listening. If you give them the opportunity to listen, even if it seems like they're doodling or they're on their phone, they're listening. Like it's an interesting topic to them. They all want to know about their bodies. And it's an excuse, I think, to say, oh, they can't handle that. They definitely can handle it.
It's interesting because traditionally it was, you don't know anything. And then when you get married, here's the lowdown, which is exactly how we treat sexuality or even physical touch. There's nothing until there's everything. Wedding night, right? There's the expectation to do everything. It's not like, okay, let's take step number 1, then step number 2. It's like 0 to everything. And we're transitioning culturally to no, we need to prepare everybody more without sexualizing them, giving them ideas, but also protecting them, because somebody needs to tell them that if you have sex, there's a consequence. You can get pregnant. So there's this dynamic that.
So yes, I mean, I would agree with that. That's me. That's me telling, like explaining like, hey, if you have sex, you can get pregnant, or, understanding what, well, let me back up and say that, part of the beginning of a talk that I will give is external anatomy. I usually start with that. And one of the areas on an external genitalia of the women is a clitoris. And I talk about what that is. It's not like I'm sitting there being like, oh my gosh, you guys, this is like a really big deal, right? I'm not sexualizing it, right? Like I'm not making it seem like this is all we're going to talk about today. This is part of your anatomy. This is the function of it. And you need to know about that.
For teenagers, that is, say the word nida, it already feels sexual, even though it's the opposite of that.
Right. Well, I think that the parts that I'm talking about are used during sex. They become sexualized when you talk about them in a sexual way. So there's kind of two ways to think about it. Me as the doctor coming in and giving education, I'm not talking about anything in a sexual way. I'm like educating you on your sexual organs and the function that they have. Because I could be talking about the clitoris. I do hear what you're saying. Okay. I think that, but there's still two ways to look at it. There's, yes, these are, I even had, in my last talk, I had someone ask me like, so how do you not become sexually aroused at the gynecologist's office? And I thought that was a really kind of,
or for
a woman. Yeah, for a woman. If you're getting an exam done and it's an internal exam, how are you not sexually aroused? And I thought that was a really intuitive question. So I'm like, she kind of put together, okay, like there's an actual tool, the speculum is going inside of the vagina. And okay, that kind of similar thing happens during sexual activity. However, it's a very different environment and that matters. And I think that kind of speaks to the difference in what we're talking about. Like, the goal of the gynecologist, I'm doing a pap smear, I'm doing some testing, I'm making sure that you're okay. We're in a very kind of sterile medical environment. There's no feelings of attraction, right? It's a different environment. And that very much affects like how you feel in your head, very much affects how your body feels. The whole connection between desire and arousal. Hopefully there's no desire and arousal in the gynecologist's office. And I think everyone kind of understood, oh yeah, like that's not a place that I feel super sexy at all, right? But in the bedroom with my husband, yeah, and or with someone that I'm attracted to, I feel a lot differently. So yes, is the same action somewhat happening? Yes, but let's separate it. And one is more medical and one is more emotional, sexual. And so we can talk about these things and those two ways, if that makes sense.
And let's just say there are female OBGYNs. Like that's an option. That's something you can seek out and be proactive.
For sure. Yeah. I think she was just kind of like, well, there's something inside of you, or like, what if,
doesn't matter.
We're just like physically, what if you start feeling aroused, that kind of thing. But it was it was a good question. I was really happy that she asked it because I think some people also like get worried about that. And yeah, I was glad to answer it.
Let's go to the next stage. Can we jump to being married?
Yeah, I think we can jump to being married. Okay, I think that's like generally in a orthodox from environment, that's kind of what she would experience next. And remember, before then comes kala classes, where women often learn, they get a lot more sexual information along with the hashkafa and the halacha of marriage in general and Taharas Hamishpacha. And I think that's a time when women start to become a lot more maybe aware of their cycles and time frame is, how long their periods are, how much time between their periods there are, and start to kind of focus a little bit more on that. And then when it comes time to having sex for the first time in the beginning of the marriage, I think there's a lot of focus these days on the pain that a lot of people experience, bleeding, decrease in libido or sexual desire. And there's a lot of focus on the problems that can arise in the beginning. And I think the old way of thinking was like, oh, whatever, they'll just figure it out. Like, it'll be fine. They just need some time and it'll be fine. And I think now there's a lot more awareness to all of the kind of problems that can come up.
Does that add to the anxiety?
I think it does. I really do think it does. I think it's great to have the education of, hey, if you're having pain, this is who you should seek out first to help diagnose why. And this is another medical provider that could help solve your problem. Instead of like being like, oh, this is hopeless. I'm suffering. I have no one to talk to. Like, my doctor doesn't know what's going on and I'm just going to suffer for the rest of my life like this. So if you like equip women with, oh, I'm experiencing this. So now I know my next steps. This is what I have to do. Or I have a lot of people who come to me like worried that it didn't hurt and that there was no bleeding afterwards. I'm like, congratulations. That's normal. Again, like getting back to this, like, can we make normal again? Like it's kind of just understanding what could happen and what to do if there's a problem in some way. And so that's, I think, a big part of the education in this kind of like when you start having more of a physical sexual part in your life. And I think that's partly a college teacher job, partly your gynecologist or doctor's job. And just, I don't know if you end up talking about this with mother or friends or people who you think have been through this before and can give a little bit of their experience or a little bit of advice, great. But just always with a grain of salt, remember that everyone's coming with their own perspectives and their own experiences, which may not be yours. So,
okay, next we have pregnancy, or
before that,
like,
trying to get pregnant.
Well, trying, knowing if you're pregnant, not knowing if you're pregnant. The 2 weeks of trying, can you have alcohol?
So then there's whenever someone is not contracepting in some way, whatever that way is, if at all, and trying to get pregnant, kind of understanding what is important to think about as you're trying to get pregnant, or even before you're trying to get pregnant. Is your health optimized? Are you on any medications that maybe should be switched or you taken off of because they're not safe in a pregnancy? Just vitamins that you're taking, and just kind of preparing your body for pregnancy.
Acid.
What? Folic acid.
I know some schools put their 12th graders on them.
Oh, wow. Okay. You really only need to be on it for like a month or two beforehand. So, but I guess, hey, if you are dating that summer, like, why not, right? The goal is not just, I need to conceive. The goal is, how do I prepare my body for being the most optimal place for my baby to grow in? And I think that the mother part of it gets a little bit lost in I just need the pregnancy part of it. So
I don't think I ever heard anyone say that before.
Yeah. I mean, I think you need to focus on the moms too, right? It's not just about the baby. And then, if there's difficulty in getting pregnant, being able to recognize that, and that comes all the way from a talk that you heard or education that you had when you were much younger, when you were not thinking about getting pregnant. It was like, oh, this is what my cycle is supposed to be doing. If it's not, or if I'm not getting a period every month, and it's every 3 months, hey, I remember someone said that wasn't normal. And now I'm having a hard time getting pregnant. Ding, 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 right? Like, it sets off light bulbs that okay, I think I need to go to my doctor and discuss this, because it was a little red flag that maybe there's an issue, as opposed to, I've been trying for 5 years. Why am I not getting pregnant, right? Look, there's many, many reasons for infertility, female and male factor.
Don't worry, your parents or in-laws will interfere before you hit 5 years.
That's a whole nother talk. But just kind of knowing what should happen and what could happen. And then what's my plan if things aren't going as expected? Who do I talk to first? When do I talk to them? On the flip side, if I'm not pregnant in a month after wanting to try, that's also normal to not be pregnant right away. Sometimes it can take a few months. Sometimes it can take 6 months. Sometimes it can take for up to a year. We don't really give someone medically the diagnosis of infertility unless they've been trying for up to a year, under age 35. So we also, it's not abnormal to not get pregnant right away. And we have to kind of remember that that's okay, even though you're feeling anxious about it, right?
And after 35?
After 35, we do about 6 months. And then we start kind of looking into it and doing some more testing. And then, hey, mazel tov, you find out you're pregnant. Wonderful. And then it's about having a healthy pregnancy, finding a doctor you like. And one of my biggest pieces of advice is, it's super awkward when you find out you're pregnant and you feel a little bit rushed. Oh no, I have to get into the doctor and now I need to find a doctor. But I feel like if I start asking around, everyone's going to think that I'm pregnant and know that I'm pregnant, and I feel super weird about it. So
asking for a friend.
Yes. Asking for a friend, which is always for yourself. So always before you're entering this parsha, just like you are buying a sheitel and picking out a wedding dress, just have a doctor, have a list of doctors that you can go to when the time comes, so that you don't have to feel awkward about asking when you are newly pregnant. And then, finding someone who you like is also really important, right? Because if you feel comfortable with your doctor and you click personality wise and you have found someone who's kind of in line with where you're at medically, I think that your experience will be so much better and you won't often feel like you're fighting your doctor because you have different perspectives. I mean, as many doctors as there are different personalities and different perspectives. So it's important to find someone who you click with because you're going to be spending a lot of time with them and trusting them with like the most important thing in your life.
So I don't understand what that means because you're not looking for a friend. So what does it mean you're looking for somebody you click with and you don't know what your medical opinions are? You only know it when you're dealing with it, and then it's too late to switch doctors. You can, but that's when you find out if you're clicking or not.
Right. You're not looking for a friend. You're right. You're looking for someone who you can have conversations with where you feel heard. And usually you click with someone, you click with someone when you feel comfortable, like having a back and forth conversation. It's not just like, oh, here's a prescription, I'm throwing you out the door, or just their manner of speaking could be like, I need someone who's like super academic and that's what I feel comfortable with as a doctor, or I need someone who's like super chill and relaxed and makes me feel super welcome when they walk in the room and ask about my kids. So it totally depends on what your personality is of what you need. Everyone needs something different that's just going to make you feel more comfortable and have like a better experience in the office and in the hospital.
Okay. What's next?
Yeah. So next is, we could say it's either like child spacing or when you're done having kids, whether that's a conscious decision you make or just something that your body made for you, depending on, and something that is a very big part of my kind of education, like on Instagram or on my website and in my consultations that I do is talking about contraception. I really don't think there's a lot of information at all about contraception out in the frum world. I think it's something that's a little taboo to talk about openly. And there's also not a lot of time in doctor's appointments for huge explanations on like every single thing out there and like, hey, pick, what do you want? And so that's also a really important part. Like we focus a lot on making a family and getting pregnant and fertility and infertility, that I think we also need to consider the flip side of that.
So we had a panel on birth control, which I would highly recommend. And I'm sure there are new options since we did that episode. But we haven't spoken about postpartum at all or anything in pregnancy that you would want to share, because you don't necessarily get a crash course from your doctors. Your doctors have to check what they need to off the list based off of when they're seeing you. But what do we need to know?
As far as birth control goes?
No, postpartum / pregnancy, just the physical body. And during pregnancy, like anything that's normal or not normal. I know the doctors go over a lot of things, but what are the things doctors don't talk about that you find out socially or on yourself?
I think that's so different for everyone. I think that everyone's pregnancy experience is so vastly different. And even like within the same woman and their, multiple pregnancies can also be very different. So it's really hard to say, oh, this is the one thing you missed, or this is the one thing, in education, this is the one thing, I missed here or there. And same with postpartum. So pregnancy, it very much depends on what is going on in your pregnancy. Are you having a high-risk pregnancy? Is the baby not growing? Do you have high blood pressure? Do you have gestational diabetes? Do you get really horrible headaches? Are you super nauseous and have the hyperemesis? There's so many different symptoms of pregnancy that, could be a normal part of pregnancy. They're common. They're super uncomfortable, but it's so individual. And so it's hard for me to kind of like sum up pregnancy.
There's medication out there for severe nausea. Hyperemesis. So it's not like this is normal. If you're having severe, when you feel like you can't handle it, ask your doctor. There are options, right?
Right. I mean, using that as an example, nausea is a very normal part of pregnancy. It's due to the HCG hormone.
But what if you can't keep anything down for a week straight?
Right. So that's when, and I think this I'm using that as an example, but that's an important point, I think, is that there's so many things that are normal but can become extreme. And it's knowing it's twofold. It's your doctor being able to kind of recognize when this has become, okay, this is now, we've passed the normal part. This is getting extreme and needs treatment or therapy. But also you as the person experiencing it, if your doctor walks in their room and is like, oh, how are you today? I'm fine. Are you really fine? Or did you just spend like the last 4 weeks on your bathroom floor throwing up 10 times a day? And you're just saying I'm fine because that's like the nice social thing to do, right? And that's part of having that relationship with your doctor of like, oh my God, I'm doing so horribly. This is like really bad. I can't function, right? Where you feel comfortable expressing yourself and telling them your needs. So it really is like you do also need to say, I'm really in a bad place right now. This is really affecting my life. I can't do anything. I'm struggling. I need help. And it's really hard for a doctor to be like, no, sorry, I'm not going to give you help.
But somebody thinking that nausea is normal might not even think to say anything at their visit, especially in the earlier months when you're not even being seen so often, or you might see the doctor for the first time at 11 weeks. Meanwhile, your first trimester is almost over.
A doctor's office should always be available, especially in an obstetrician's office.
My point is, if you think nausea is normal, but nobody tells you this amount of nausea is not normal or this amount of dysfunction is not normal, then call your doctor. This is what I'm trying to have you say.
Right. Hear that. But I think on some level, if you're look, you could have the normal, like in quotes, normal amount of nausea and be also really uncomfortable. But how are you, if you don't ever verbalize, I'm having a really hard time. Is this normal? This could be normal, but I'm still having a really hard time.
Okay, so your message is speak up, try to verbalize what you're experiencing.
How are people supposed to read your mind, right? Should there be education? 100%. But I could give you a piece of education. I could write a book. I could make a pamphlet that says nausea is normal. What's normal? What's normal for you? What can you tolerate? I may not be able to tolerate throwing up once, and you may be able to tolerate throwing up 5 times, and you go about your day and you're fine. So where do we decide what needs treatment or not, right?
I guess when it's interfering with your life, that's how we...
Right. Interfering with your life is kind of when we start to like, okay, we need to address this like seriously. Postpartum, especially in the US, right? I have like different perspectives now being in another country, but it's awful in the US and it's a shame and we can do better.
And if you're a student in Israel, also it's awful.
Right. The postpartum period for women has become so much harder than it used to be. I think that we used to have just social structure and family structure. We used to have a lot more support. We don't have that as much. We don't have it in the workplace. People live much further from families these days. We just don't have that structural built-in support to our lives in the same way that generations ago there was. And it's a shame because it filters into the medical world, definitely. We don't have a lot of, I'm seeing you every 4 weeks, every 2 weeks, every week in your pregnancy, boom, you have your baby. Okay, see you in 6 weeks. There's not a lot of structured follow-up in a time where women can be very vulnerable. Are there reasons for that? Yes. Are they always good reasons? Absolutely not. A lot of it has to do with just how the appointments and structure and time constraints that we have. But again, if something is going badly, like if you are 3 weeks into your postpartum period and you are not coping and you're not managing and you're having lots of nursing issues or whatever it is, again, no one will know unless you say something. They won't. I mean, we're not sitting here telepathically reading your mind of what's going on at home. It's okay to call the office and to say, I'm struggling, I need to come in and discuss it. Even if it's before your 6-week appointment, that's okay, right? There's no rule written in stone that the next time you can come in is in 6 weeks. So my biggest message is advocate so that we can help you. The mental health system in America is also really hard. We can say, hey, go see a therapist. I need to hook you up to therapy. And it's so hard to get into one. I get that and I understand it. And don't have a great solution, like immediate solution for it, unfortunately. But the one thing I would say is give yourself some grace, give yourself some time, and like, don't demand perfection of yourself. You know what your job today as a new mom is? Eating something, sleeping when your baby sleeps, not even getting dressed. You want to wear your yoga pants, your sweatpants all day? Go for it. Like that, a goal for you is not, oh my God, I need to look like a super cute, model or influencer, right? Like my hair doesn't need to be perfect. It doesn't have to happen. But we're just like thrown these images of like, this is what my perfect nursery with no laundry on the floor, and like the garbage can is empty and the dishes are all done. Like, that's not real. And like, we need to understand that that's not real. And like, it's okay. This is your time to heal. Like, that is what you're doing. You've just been through a major medical event over the past 9 months plus the last couple months since delivery. That's a big deal. And let yourself heal. Healing is the most important thing.
Before I interrupted you to talk about pregnancy postpartum, you were going to go to the next stage. So that was birth control and the importance of knowing about it, learning your options. What's after that? Because we never get to menopause and body changing and starting to want Botox. Yeah.
Right. So that's what's after that. I mean, when you have kind of decided, or you know what, I'm not going to this is a conversation that doesn't even involve like pregnancy and wanting kids or not wanting kids. It really is like more of an age discussion. And look, average age of menopause is 51. Okay. That's an average number. That means some people go through menopause before and some people go through it after. The definition of menopause is no period for 12 months. Okay. That is when you're in menopause. But what about how you get there? Right. And so you can your body starts changing. It could be up to 8 years before that process actually hits, right? Just like on the other end of the spectrum in puberty, you don't like hit puberty overnight. It's a few year process of your body slowly changing, and then boom, like you're kind of there. Like all those changes have finally happened and finally done, and then you're done with puberty, right? So they're kind of the same thing, just the opposite of what your body's doing. And I think that being able to recognize those changes and not think something's like super wrong with you, and being like, oh, hey, my body is changing. And this is maybe one of the ways it's changing. So what are the symptoms that could happen?
Sweat
flashes for sure. Difficulty sleeping, night sweats, headaches, mood changes. Your body changes where you just get a little bit more fat on the inside of your body. So a little bit more of that like central weight gain that's much harder to lose than the type of your fat that's more like right under your skin. Did I say like mental fogginess?
Delightful. Sounds delightful.
Yeah. Drier skin. Some people get depressed, anxious.
Any positive things?
Positive things? You don't need to worry so much about, well, this is, I guess, after menopause, but
getting pregnant.
Worry about getting pregnant. And I think that, look, the changes that happen with menopause, like the side effects of menopause or symptoms of menopause, are not enjoyable, but you're also really entering this phase of your life where like you have kind of almost like hopefully grown into yourself, right? Like you're more sure of yourself. You are kind of done with the like little baby stage where you're just running from one thing to the next. And most people at this phase of their life, they have the time almost to focus a little more on themselves, right? They're like, okay, now that I've taken care of like my whole family, I can focus on me a little bit. Like everyone's getting older. I have a little bit more time. I can kind of, I have life experience. Like, what do I think about the next half of my life? So I think that's kind of like a nice perspective of like, you're not just getting older and that's a bad thing, right? Like it's a good thing to get older. I did hear one menopause specialist talk about it in a really great way that in menopause, your estrogen and progesterone levels are decreasing, right? That's what your ovaries are kind of slowly decreasing the production of it. Your levels getting lower, and your brain developed and was so used to having these levels of hormones around And then it's working on rewiring itself. How do I now function as my person in a different hormonal environment? And so it's just like a rewiring. I got to kind of figure myself out again, and that can take time and that can be frustrating and that can come with symptoms. But there are so many treatments for symptoms. And yes, hormones are one of them, hormone replacement therapy, but there are so many others. And one of the best things you can do is eating well and exercising. And no one likes to hear that from a doctor, but it can make a huge difference. But I do think that there is now, lately, I feel like I've seen, maybe it's just my social media feeds because of what I do, but a lot more awareness of this phase of your life. And like, okay, we can talk about this one too, like this is something that needs to be talked about a little bit more.
We didn't mention anything about loss and the different types of losses and normal in that in the most medical sense.
Sure, I can definitely. When it comes to pregnancy loss, which is definitely something that kind of comes up in the years that women are families are trying to get pregnant, that's something that you may like almost feel very alone in, but I know we were talking about normal, right? In the beginning of the talk here it's a very common experience. And I think that, as we talk more about infertility and pregnancy loss, that we see that there are these communities of women that have been through similar experiences. And I think it's as horrible as it is to kind of go through a pregnancy loss, it definitely is something that you can always kind of find your support group or find people who've been through it. You're definitely not the only one, unfortunately. And another thing that I have people ask me all the time is, I lost a baby, I'm pregnant again. How do I feel less anxious? And my answer is, I have no answer for you. No one is ever going to have an answer for you because until you have your baby in your arms, you won't feel less anxious. So stop trying to get out of that and fix it and say, okay, there must be some magic, something that someone can tell me that I'm going to feel totally fine and not worry. No, like it's okay to worry. That's a normal human emotion, especially after the experience you had. Yeah, I hear it. I hear you. Like I'm here as your doctor to say, I'll let you know, like if I'm worried, or I can reassure you whenever you need to be reassured, but I'm never going to be able to take that worry away until you have your baby, and kind of understanding that that's okay, right? It's not easy. It's not going to be like an easy, road afterwards. And if you don't ever get pregnant after that loss, that's also something hard to deal with. And if you don't want to get pregnant after a loss, that's also okay, right? There's so many ways you can kind of go with this, but just know that definitely not alone. And thank God, especially in the frum world, there are so many wonderful organizations that really offer support for like every aspect of infertility and pregnancy loss, which I think is wonderful.
And we'll link your social links into the show notes. And thank you so much for coming on. Thank you for listening until the end. Next week, we will have an episode with a kidney donor, and I'm excited to share it with you. Please rate and review this podcast. Share this episode with a friend. I really appreciate your support. And check out the other podcasts on the Jewish Coffee House Network. If you like the show and you'd like to do a little bit more, you can buy me a cup of coffee. The link is in the show notes. I appreciate you so much, and see you next week.